Good afternoon, everybody. This is Congressman Mike Levin. Thank you, as always, for joining us for another virtual town hall. We'll be talking about the coronavirus and many other topics this afternoon. And believe it or not, this is our 46th virtual town hall since the beginning of March, when COVID-19 impeded our ability to do in-person town halls, which we missed very much. We did one of those a month up until that point. But nonetheless, I'm so grateful to our team for the 46 virtual town halls that we have done in the last several months. I want to thank Jeremy and the entire team working on video conferencing. I want to thank Ellen Montanari, the amazing Ellen Montanari, for helping us coordinate all of the questions. And of course, I want to thank my whole campaign team, who is working around the clock. 10 days to go before what I believe is the most important election of our lifetimes. And our whole team, our great campaign manager, Adam Berkowitz, Park Skelton, our wonderful political director, Hunter Phillips, our great field team. Thank you for all that you do. It really does mean the world to me. And I want to thank our volunteers, the VIPs, the volunteers in politics, for all they do as well, and all they'll continue to do over the next 10 days. I'd be remiss if I didn't say, if you're interested in volunteering, please visit our website at mikelevin.org. That's MIKELEVIN.org. With that out of the way, I am delighted and honored, as always, to welcome back Dr. ANDREA LACROIX. Thank you for being with us. As always, I counted, this is the 7th time that you've been on one of our virtual town halls, which is absolutely incredible. And I just want to make sure you know, before we go any further, how much we appreciate you. Thanks for being with us. So I also wanted to let our viewers know we had hoped to welcome Kyle Ann Hunter from the Brady Campaign to Prevent Gun Violence. And unfortunately, Kyle Ann had a last-minute family issue. Everyone is okay, but nonetheless, a last-minute family issue come up. And we're going to reschedule her appearance very soon. And I look forward to that, because she really is amazing. And I've been honored to work with Kyle Ann and the Brady Campaign, particularly on something called the Prevent Family Fire Act. And as we think about the issue of gun violence prevention, it is rare that you hear of a truly bipartisan initiative to prevent gun violence. But with the help of the Brady Campaign and Kyle Ann, that's what the Prevent Family Fire Act is. It is an initiative that would provide a tax credit for safe storage devices for firearms. And we know all the research suggests that they will make a big impact. The safe storage devices will make a big impact. The bill was introduced. It's truly bipartisan. The list of people that I worked with on it: Rodney Davis, Republican of Illinois, is the lead sponsor, along with myself. Brendan Boyle, Democrat of Pennsylvania. Elise Stefanik, Republican of New York. Dr. Kim Schreier, my great friend Kim Schreier from the state of Washington. And Mike Turner, Republican of Ohio. We're all leading this initiative. And what it would do, again, is provide that safe storage device tax credit. We know that over 75% of school shootings involve kids and teens having access to unsecured or unsupervised firearms at home, and more than 80% of guns used by youth in suicide attempts were kept in the home of a victim, a relative, or friend. Keeping firearms, this is according to the Brady Campaign now, keeping firearms safely stored reduces the chances of family fire by 73%. And according to a study released last year, and even a modest number, a modest intervention dramatically decreases the number of youth firearm deaths. The minimum we're talking is around a third. Again, the maximum is close to 3/4 of those accidents that can be prevented. So it's a small step. It's a bipartisan step. And along with other measures to prevent gun violence, like universal background checks and much else that we're working on, and that we hope to pass into law in the 117th Congress. I'm very grateful to Kyle Ann and the Brady Campaign. And I also know that we're being joined live right now by many of our friends from Team Enough. I want to encourage them all, please stay, because we're going to talk a lot more about gun violence prevention. Some of you put questions in, and we'll be addressing those. And of course, we'll be speaking quite a bit about COVID-19. And with that, I want to again welcome back Dr. LACROIX. Dr. LaCroix is a distinguished professor and chief of epidemiology in the new Herbert Wertheim School of Public Health. Hope I said that right. And human longevity science at our very own University of California at San Diego. She's also the director of the Women's Health Center of Excellence at UCSD. She's an expert in healthy aging and in women's health. She received her doctoral degree in epidemiology from the University of North Carolina at Chapel Hill. She still is willing to talk to me as a graduate of Duke University after all these town halls. I'm grateful about that. She also served as an epidemiologist for the National Center for Health Statistics and the National Institute of Aging before becoming professor of epidemiology. She now serves on the board of the Scientific Counselors for the National Institute on Aging. She has authored over 460 scientific publications. That's incredible. And is a Thomson Reuters highly cited researcher. Dr. LaCroix, you're amazing. Again, welcome back.
Thank you. Nice to be here. Did you want me to say anything now or wait?
In a minute. Okay. I want to provide everybody with a quick update. I think we all know the update, which is that COVID-19, unfortunately, is still here. We saw yesterday a record number of cases, and the numbers continue to be astounding and tragic, but I think it's important that, as with all these 46 town halls, we just briefly go over them. We very sadly passed 223,000 lives lost as a result of COVID-19 in the United States. So again, while we have around 4% of the world's population, we have roughly 20% of the world's COVID-19 related fatalities. It's an awful statistic. We're all shaken by that statistic. And it is husbands, it is wives, it is fathers, it is mothers, sons and daughters, brothers and sisters, not just statistics. As I mentioned, around 8.5 million cases in the US. California, we still are leading in terms of the number of cases, although it appears Texas is quickly catching up. We have 894,000, give or take, cases in California, a little over 17,200 deaths. In Orange and San Diego counties, I always talk about what's happening in our counties. We're still firmly entrenched in the red tier. You know, the governor back at the end of August put the purple, red, orange, yellow tiers in place. That determines what can stay open. That determines the capacity for different businesses. We are firmly in the red tier in San Diego and Orange County. That, of course, has impacted a lot of things, among them the theme parks. I know our friends at Legoland in our district, as well as up in Disneyland in Orange County, not thrilled, but the feedback from Sacramento is that we have to be in the yellow. We have to be in the least restrictive tier, for example, before those theme parks can open. A number of other businesses are able to open, but with reduced capacity. And as always, I'd recommend, if you're interested, go to the California ca.gov, covid19.ca.gov, and you can see everything about what's open, what's not. Orange County, approaching 58,000 cases and 1,434 deaths. San Diego County, around 53,500 cases and 866 deaths. So we're keeping very close watch. I get a daily update on all the different metrics that the state is using. And I think, as always, we know what works. We know that if we wear a mask, if we socially distance, that it will obviously help reduce community spread. And now, as much as ever, that's exactly what we need to do. We see these cases going up, but we have to make sure we keep each other healthy and keep each other safe. And I know that Dr. LaCroix is going to be speaking more to this in a moment. I also want to mention what's been happening in Washington, D.C. As you probably know, there have been back and forth negotiations between the House and the Senate and the White House for many months. I see it sort of as the three legs of a stool. The House, we passed our bill, the initial HEROES Act, all the way back in May 15th. It then took June, July, August for the Senate to do anything at all. They passed $1 trillion bill called the HEALS Act. They then passed, they regressed from that and passed a $650 billion bill after that. Unfortunately, Mitch McConnell has totally hit the pause button for the time being. despite the best efforts of Treasury Secretary Mnuchin and Speaker Pelosi to reach an agreement. And I was telling Dr. LaCroix before we joined you live that I felt earlier this week there was a pretty good chance that right now, here on Saturday, I would actually be in Washington, D.C. I figured maybe Friday or Saturday we'd be voting on this initiative, on this new HEROES Act. But unfortunately, McConnell said that he didn't want to bring it for a vote. That sort of killed the effort before the election. And again, you have to have all three legs of the stool. So we have the Speaker negotiating, we have the Treasury Secretary negotiating on behalf of the President. But the third leg of the stool is McConnell, and McConnell has prioritized the confirmation of Amy Coney Barrett to the Supreme Court over more relief for the American people, despite the fact that people are really hurting out there. We know that 26 million are on unemployment insurance. Of the 11 million, or of the 22 million that have lost their jobs throughout the pandemic, only 11 million are back at work. We also know that there are at least 5 million that are long-term unemployed as a result of all of this. And we see those jobs numbers every week, and it's daunting. And we also know that we need a lot more funding to crush the virus itself. I've said, I think all 46 times that we've done these, we cannot have healthy people, or we can't have a healthy economy unless we have healthy people. And the only way that we have healthy people is if we crush COVID-19 with the adequate testing and contact tracing. Here we are, only 10 days before the election, end of October coming up, and we still don't have a comprehensive national testing strategy. This was supposed to be delivered to the Congress all the way back in May, and it has not been. We still lack adequate testing. Most epidemiologists and others, and Dr. LaCroix can back me up, believe we need 4 to 5 times more testing than we are currently getting. And unfortunately, you have a president who's, when he is not hosting super spreader events at the White House or disregarding the public health advice from his own experts, he is discrediting the importance of testing, saying that more tests are the problem, when in fact more tests are exactly what we need. There's a widespread false narrative out there that contact tracing isn't worth doing or is ineffective. That's clearly wrong as well. And all you need to do, again, is look at that figure. 4% of the world's population, over 20% of the fatalities. All you have to do is look at how we have done over the last several months, all the way back to the initial failed testing back in February and March, when the CDC from the beginning, the testing had flaws, and we were not able to ramp up in a effective and efficient manner in the many months since, pitting the governors against one another state by state rather than having a comprehensive strategy. So without getting into the politics of it, I think a different approach is warranted, is necessary, and will be quite encouraging. I listened closely to former Vice President Biden's speech about his plan, and I listened very closely to the different discussion during the second debate the other night, and I think the contrast could not be clear. We've got to crush this virus, and we've got to do so in order to get our economy open again in a safe and effective manner. The last thing I'll say on COVID before we hear from Dr. LaCroix is, at the same time that the numbers are going up with regard to COVID, the Affordable Care Act continues to be under assault. And you've got Amy Coney Barrett now potentially on the Supreme Court. That would provide another vote against the Affordable Care Act. We had the President of the United States, as we'll hear on 60 Minutes, which is being broadcast tomorrow night, express the desire that the Affordable Care Act be overturned, be undermined by the Supreme Court. What that would do in the near term, it would throw millions of people off health insurance, including people who lost their employer-provided health insurance as a result of COVID-19. It would also jeopardize the protections for the 129 million Americans with pre-existing conditions. And oh, by the way, COVID-19 would now be a pre-existing condition, potentially jeopardizing health insurance for 8.5 million people and counting who've been subject to this virus. It was absolutely unconscionable. We cannot allow it to happen. We must fight for the Affordable Care Act. We must fight for actual protections for those with pre-existing conditions. I thought it was stunning, stunning. The president continues this false narrative of saying, we've got a better plan right around the corner. You'll see it in a couple weeks. He's been doing this since 2017. And the reality is that ever since the late, great John McCain gave the thumbs down on the floor of the Senate, they have not come up with an alternative plan. All they have tried to do is destroy and undermine the Affordable Care Act in the courts and in the Congress, and we aren't going to allow it to happen. And in 10 days, we're going to repudiate that effort to attack the Affordable Care Act and undermine protections for those with pre-existing conditions in a big way. That's my prediction anyway. With that, I have one other thing I want to mention. Despite all of these crazy partisan issues that are going on and the polarization in our country, there are good things happening in Washington, D.C. And I am very proud to tell you that this past week, our fifth bipartisan veterans bill was signed into law by President Trump. So those of you that have been following, that have watched what we've been doing for the last couple of years, you know that I chair a subcommittee for the House Veterans Affairs Committee for Economic Opportunity. You know that we've introduced, and with the help of many of my friends across the aisle, 20 bipartisan veterans bills. You may know that 12 of them have passed the House, and now 5 have become law. I want to speak about one that I'm particularly excited about that has passed the House, that is sitting in the Senate, that has great support in the Senate, and that I think has a great chance to become law before the end of the year. It's called the Deliver Act for Dependable Employment and Living Improvements for Veterans Economic Recovery. And I worked with a number of my Republican friends and colleagues like Gus Bilirakis from Florida, Jody Arrington from Texas, Phil Rowe from Tennessee, Brian Fitzpatrick from Pennsylvania, and even the Republican leader, Kevin McCarthy, worked with us on this legislation to provide job opportunities and resources for veterans who are looking for that next job, for veterans who are either homeless or at risk of becoming homeless. It is a great comprehensive bill, and I am very proud of it. In terms of the bill that just passed, that's one that I did with Dr. Phil Rowe, also of Tennessee, the Vet Center Eligibility Expansion Act. What it does is extend the Veteran Affairs, readjustment counseling, and related mental health services that are offered through the VA vet centers to National Guard and Reserve troops who did not deploy to combat areas, but nonetheless participated in drug interdiction or fighting national disasters or emergencies. And there are a lot of people who will benefit from this legislation. So at a time when it seems like our government is torn apart by partisanship, there are things getting done, and our work on the House Veterans Affairs Committee is a great example of that. So before we get started with questions, before we get started hearing from Dr. LaCroix, one other thing that I want to do, turning back to the issue of gun violence prevention, STEPHAN Abrams, who's the national coordinator of Team Enough, has recorded a brief video. And since we don't have him here live, I want to make sure we play that video. Jeremy, if you could play that video now, would be great.
Hi, everyone. My name is STEPHAN Abrams, and I'm the National Chapter Coordinator and Fellow for Team Enough. And I'm so excited that I will be personally endorsing Mike Levin for his re-election campaign. Mike is not afraid to stand up to the NRA and tell them that we have had enough. He has kept his promise not only to me, but to all the young people in his district when he said that he was going to fight against gun violence.
Can you hear the video, Jeremy?
He is a crucial part in keeping our gun violence prevention majority in the House. Please vote for young people like me who are not going to be old enough to vote in this election, but know that Mike will represent their interests in Congress as well. We are the generation that will end gun violence, but the first step to that is electing leaders who will do so. So please, go vote for Mike.
All right. Terrific. Thank you so much, STEPHAN, for that video. I'm grateful for Team Enough and for all your activism, for all the wonderful work that you do. With that, I want to give Dr. LaCroix some time for some opening remarks. That was a lot to cover, Dr. LaCroix, but thank you as always for being with us. We appreciate your educating our district on all things that are happening with regard to COVID.
Well, Congressman Levin, you did a great job going over the picture in Southern California and across the country, so I don't have a whole lot of other things to say. Let me just reflect on a few of the things that you did say. One is that if John McCain hadn't flown across the country with a brain tumor to vote in the healthcare legislation that you speak of, millions of Americans would not be covered through the pandemic right now. And I do totally agree with Senator Harris that they are coming after healthcare, and that in the middle of a pandemic, this puts many, many Americans at risk. That's hugely sobering. I didn't give Jeremy and this maybe won't project, but the graph I'm trying to show you just shows you for the second day in a row, we have over 80,000 COVID cases in the United States of America. Hospitalizations are on the increase across the country. It feels kind of quiet in Southern California with COVID at the moment, but given the tremendous increase in cases, we're expecting deaths to increase above 1,000 a day again, and given the 80,000, perhaps significantly above 1,000 Americans a day will begin dying shortly. So it feels like another wave is in progress, perhaps a third wave, if I could show you this graph that was in the New York Times yesterday. What does that mean to us? You say we're firmly implanted in the red tier, but the problem is this: we are at the very top of the red tier in San Diego County. And only because we're testing a lot did the state give us credit for the amount of testing that San Diego County is doing. Otherwise, we would have been in the purple tier. We were at 7 cases per 100,000 last week, which allows us to stay in the red tier for 2 more weeks. But if we don't decrease that number significantly below 7 and meet some other criteria, we're going to be in the highest tier again. And so there's been an emphasis on what can we do in San Diego County to bring this number down. And all of us know that what we can do is what we've been talking about doing in these town halls and in every place you've seen. We can wear a mask and socially distance. So why are we so close? Why are we so close to 7.1 per 100,000 and the purple tier? And the answer is, if you look at the outbreaks, if you look at where the cases are in San Diego County, there's no simple answer. This virus is everywhere, and there's just a little too much of it around for us to be seeing the cases go down. I also want to, say that what that means is we just need to pull back a little bit. Sit farther apart if you go to a restaurant. Make sure you're far from other people and make sure that you're always masked. That's about the only thing we can do until we have a vaccine. Otherwise, the good news to report is at UCSD, we have more than 5,000 students back on campus. They tested before they came to campus, quarantined for 14 days, and tested again. We test them regularly now that school has started, and each week I see that somewhere between 10 and 20 students, faculty, and staff are found to have a COVID infection. They're immediately contact traced and put into quarantine, and that's how we're controlling the pandemic on campus. And it works really well in the sense that that number is staying between 10 and 20, and it's not hundreds and it's not thousands of people. So I think that's one piece of good news. We've got to stay out of that purple tier. Another piece of good news is San Francisco. And we really should have a guest on from San Francisco because they're in the lowest tier. They just got put into the very lowest of the state's tiers. They're a big, complicated metropolis, and somehow they figured out how to get that rate very low. I would like to learn from them because I don't know why they're doing so much better. But that's the kind of question that an epidemiologist will ask. So with that, I will stop with the opening statements and we'll get back into some of these issues. The one other thing I'll say is that there is free testing available in San Diego County. I don't know about Orange, but it's easy to find the testing sites and it's easy to get tested. So if you need a test or want to test, San Diego's been doing a large number of tests per day, something like 7, 8, sometimes 9,000, sometimes even 10,000 tests a day. So that helps us, just like on campus, identify people who didn't know they were infected, contact trace them, get them out of circulation, and that decreases the spread of the virus, and that's how we press it down. So with that, I'll turn it back over to you.
Thank you, Dr. LaCroix. Well, I definitely want to commend San Diego County and a lot of the hospitals that have worked really hard to get the testing numbers where they need to be, consistent with the best practices recommendations from Harvard and other places. Orange County, after many months of picking on them, getting them up to speed, they are getting there as well, and that's a good thing. We got a bunch of questions. We'll get through as many as we can. I want to start with one from our friends at Team Enough. This is from Giselle, and she writes, how do you maintain your trust in the political system during this time of hypocrisy and misinformation? What can you say to encourage us as young people that the government really does work? Well, I think personally, all you have to do to be hopeful is look at the voter turnout over the last week or so. And it is really amazing to see people going early to vote, whether they're voting at home, whether they're turning their ballots in via the USPS, or they're going to one of the drop-off locations. There is incredible strength in numbers. And never let anyone tell you that you cannot personally impact our democracy, because at the end of the day, each of us individuals, that's the only thing that truly at the end of the day impacts our democracy. It's on all of us to participate. And when I see record levels of early participation, it gives me great optimism for the future. The other thing is, I just look at the age of the average volunteer on our campaign. And we have volunteers of all ages, of course, but I am so encouraged when I see young people involved. Young people, whether they're for us or against us, I'm really thrilled that they are taking their civic engagement seriously, that they know that their activism will make a difference. And I would just encourage you, tell your friends. I'm sure if you're part of Team Enough, you're already doing this, but just tell your friends, tell your family. Particularly if you got people in your family that traditionally don't vote, or they're intimidated by it, or they don't know, every ballot measure or every candidate, just encourage them. Just encourage them and remind them, just as I am constantly reminded, of the real differences in these two candidates for president, the real differences in the two candidates for Congress, because there are vast differences on virtually every issue that you might consider important. Again, the stakes are huge. Make sure everybody is aware of those stakes. And then the other thing I'll say is that here in San Diego County and Orange County, it is so easy to cast your ballot. The registrars in both counties are making it so that there are really no excuses. It doesn't take that much time. Obviously, research and read about all the issues and come to your own conclusions. But then you have options. You can, again, mail the ballot in. You don't need a stamp. You can put it in your mailbox, or you can drop it off. There are huge numbers of drop-off locations in both counties. You can go to SDVote or OCVote.com, or you can go to our website at mikelevin.org for a list of those. Or you, starting right around the 30th, I think, you can go to the drop-off actual polling centers, which are all around both counties as well. So vote and make sure that your friends do the same, and we'll be a whole lot better off. But again, that inspires me every day. Here's one for you, Dr. LaCroix. This is from Serena with Team Enough. What are your thoughts on the premature opening of schools and how that affects teachers who either live with someone who is immunocompromised or are themselves?
Well, thank you for that question, Serena. We've been talking in past town halls about how complicated and politicized the school opening issue is. Ideally, for safety to be restored in schools and in our communities as a whole, we would have everyone vaccinated and a very low level of circulating COVID in the community. And as you heard us just say, right now, our level of circulating COVID is near the red tier. Near the purple tier. We're firmly in the red tier for another 2 weeks. So since we're so far from the ideal at this moment, all I can tell you is that opening schools is a risky proposition, especially for teachers and school staff at high risk, as you point out, for severe COVID and COVID death, as well as for parents and older family members in high risk groups who would come in contact with with teachers and staff or with kids at school. I know some schools have opened in Orange and San Diego County, and we have not heard about massive outbreaks yet, which is good. But the main message I want to give you is that given this situation, families need to make individualized choices based on their situation, the level of virus circulating in their community. In our case, it's significant, but not as high as other communities, and their feelings about the acceptability of the risk versus the benefits of having children in school. Teachers have to make these same assessments, except that in some cases, their jobs and livelihoods may be at risk. There are 1.5 million teachers in the US who fall into the high-risk category, 24% of all teachers. In other states where the push to open schools has been incredibly strong and political, Lisa Morgan, the president of the Georgia Association of Educators, put it this way: educators are being asked to come back into the classroom in what is in many cases an unsafe situation. Masks are not required. Social distancing is impossible because class sizes have not been reduced. And the only option educators are being given when the accommodations are being denied is to resign. They are being asked to make the choice between their safety and their careers. And we have the Occupational Safety and Health Administration in this country specifically to avoid any worker having to make that choice. Any American worker is not supposed to have to make that choice. The Americans with Disabilities Act requires employers to provide reasonable accommodations to individuals who qualify with disabilities, but this isn't able to protect many of the teachers. So, you know, I just want to say that I think communities, by and large, want everybody to be safe. It's not that they want to put people in harm's way, but people also want their kids back in school. So we'll see what happens this year. I think this situation won't resolve until we have massive vaccination, and that if there are outbreaks in school, there will be, you know, just like everywhere else in our community, there will be kids, teachers, staff, parents, grandparents getting sick with COVID, and some of them will die. That's just the way pandemics are. And people have to gauge their own risk. The other thing I'll just say, though, is, you know, in public health, we know nothing's perfectly safe anytime. And you just have to, I mean, you don't get in a car and think that it's perfectly safe. To speed up to Orange County on I-5, it's not perfectly safe. So everything has to be put into perspective. And the best we can do is support each other in making good decisions for our families and ourselves.
Well, you're definitely right about I-5. Sometimes I'll come back, you know, on a Thursday or a Friday evening from the San Diego airport, do that hour-long drive, and you're right. But thank goodness, knock wood, we're in good shape. One thing I will say, one of the major disappointments of not getting it over the finish line with Mitch McConnell and the Senate is we know how much the schools need. We know how much help our teachers need. We know how much help our school districts need, because they've told us, they've told me here locally. And we, in our HEROES Act, in our revised HEROES Act, the $2.2 trillion, we have the money that we need for schools to be able to reopen as safely as possible. Of course, as you said correctly, there's some inherent risk to everything that we do. But what's so frustrating is that one of the major sticking points, in addition to direct funding for the schools, has been the state and local funding. And to hear the president the other night at the debate say, well, it's just a blue state bailout. It couldn't be further from the truth. In California, we had a multi-billion-dollar surplus, $21 billion surplus prior to the pandemic. But one of the things I think is missed is that it's not just like that money goes to some shapeless government entity in Sacramento. 37% of state budgets and 20% of local budgets go to our public schools. And so when you cut short not only the direct funding for the schools, but the state and local funding, you are directly and indirectly hurting our teachers, hurting our schools. And so we all want to be able to reopen safely, but that means keeping our teachers, our administrators, our workers, and ultimately our families, our students and our families safe. And again, there's so much we don't know about asymptomatic transmission. You know, I'm constantly trying to read more about this and learn more about this as we go. And we just saw the Vista schools reopen, so we're watching very closely what's happening there. We have a related question from Team Enough. What's your plan to protect teachers who may have to take a leave of absence or even quit because of poor decision-making on the part of school boards? Well, I think it's really simple. Teachers should not be forced between doing their jobs and protecting their health. And so I will always err on the side of trying to provide that help to our teachers and to our schools to keep their employees healthy, to keep our teachers healthy, to keep their other workers healthy, and ultimately to keep students and their families healthy. And like I just said, we need more support to do it. And that support, unfortunately, is in our bill, and I hope that as soon as possible, if not before the election, then shortly thereafter, we can get that bill signed and we can get it on the president's desk. Here's a question for you, Doctor. This is from Allison in Del Mar, who says, can someone please explain to me how I assess the COVID risk when it comes to flying? Oh, this is a good question. Should I, because I wondered this one myself, should I take a nonstop or should I change planes? Should I sit in the aisle seat or against the window? Should I check my luggage or carry it on? Do any of those factors increase or decrease the risk of contracting COVID? And doctor, you'll be responding and I'll be listening intently because I've counted, I think I've been on back and forth at least 10 times since the pandemic began.
And here you are to say it can be done safely. So
it can be done.
You've been okay. And you probably have your own way of keeping your risk low. Well,
I do, but I'm not going to tell you until I hear from you what the right way is.
Okay. You know what I would do, face shield and face mask and, but I haven't flown since March. I haven't flown since right before the first shutdown. And that's somebody who used to fly 2 or 3 times a month. Most of our meetings are canceled and online, so it's not a hardship. But I think the theme of some of my answers today is sort of the yin and the yang of it. So let's talk about the yin and the yang of flying. It's impossible to say whether any of the choices in this question are better than others. I've heard lately, as I'm sure many of you have, that planes are safe because of the heap of air filters and that the risks have been exaggerated. I've also heard that it's better to sit by the window so that you have less exposure to the people passing by. You hear a lot of things about flying. Many of my friends and colleagues have flown when the reasons have been compelling. A good friend recently flew to Kansas because her mother just died and it was important for her to go. So doing so safe, they've done so safely, they've gotten back and quarantined themselves and been okay. In general, the best way to keep yourself safe in an airport or on an airplane is the same as the best way to keep yourself safe everywhere else. Keep a distance from others and wear a mask constantly while in the plane and in the airport. Some people won't eat on the plane or drink on the plane so that they can keep their mask on. I think checking your bag shouldn't add risk unless you end up with the bag stowed in the back of the plane while you're in the front of the plane, which I always hate. Then you have to wait a half hour while everyone else gets off the plane so you can walk back and get your bag. As long as you can keep it with you, I think that's fine. Taking a nonstop keeps you out of the connecting airport where you might encounter a lot more people than the people you're with on the airplane. So that sounds attractive. But if you're seated next to an asymptomatic infected passenger, you're having an unlucky flying day. That's just the luck of the draw. Opinions in the newspapers from my epidemiology colleagues and others vary widely on this topic. We know that people have been infected on airplanes, and one epidemiologist described planes as a tube full of germs. But on the other side, a recent paper by this guy named Arnold Barnett, who's a statistics professor at MIT, looked at the probability of an air traveler contracting COVID-19 from a nearby passenger while sitting in economy class on a 2-hour US domestic flight. He assumed everyone was wearing masks, and you'll be happy to know that Dr. Barnett calculated the risk at 1 in 4,300 for full flights, and it went down for full flights where every seat is full, and that probability went down to 1 in 7,700 when the middle seats were kept empty. So, you know, sounds like you could take a lot of safe flights with those odds. Since social distancing is simply not possible on an airplane, I myself am choosing not to fly for the foreseeable future and will only reconsider for emergencies of some sort. I would go see my children in Seattle, but they're so conservative about this, they won't have us. They would put us in quarantine and not see us, so we're staying put. Ultimately, we all have to make our own decision.
That's a great summary. I do most of that. I wear the mask without any wiggle room. I try to be very conscientious about that. Keep myself, hands washed and hand sanitizer. Haven't done the face shield yet, but may do that. But one of the interesting things is, and it's hard to say how much of it is marketing versus reality, but the United Airlines has the most frequent direct flights to and from San Diego, between San Diego and Dulles in Washington, D.C., and they have a partnership with Clorox and with the Cleveland Clinic for their United Clean Plus initiative. And I can only tell you that it reassures me to see, Clorox logos and to be handed a Clorox sanitizing wipe when I get on board a United flight. I did see that Southwest is now going to start selling the middle seats. It's been a very, very tough time economically for our airlines, for our pilots, for all that are working in that industry. And, I'd like to do everything we possibly can to try to help. And we did in the CARES Act. We provided support, and we're going to need to provide more support to keep our great airlines flying, so that when we're through the worst of this, that people can get back and get back to flying and get back to doing business across the country, traveling across the country. So important that we get our coastal tourism back on track. So important for our economy. We're talking about $7.7 billion a year in economic impact to our local economy in coastal tourism, 140,000 jobs, and the role that our airports play and our airlines play is really important in all of that. So with that, I fly a lot. I have to. I don't have a choice. But so far, so good, knock wood. And just the same when we're in the Capitol, constantly wearing those masks. And it's really been, you talked about luck. It's been luck there as well. We're all under the care of the House attending physician, who's a wonderful man. And we're always, waiting for that call, because if we're in contact with someone who tests positive, then they immediately test us, and, you'd have to be quarantined and all the rest. But knock wood, so far so good. I have not had that direct exposure to my colleagues that have been positive, because they would have immediately, called and then we would have been tested. So it's, there is some luck.
Do they test you routinely, like when you arrive or before you go in the chamber?
They do not. And that's a point of some controversy, because it was offered, the administration offered it to the House and Senate. And this was back maybe in April with the antigen, the very quick tests. And at that time, Leader McConnell and Speaker Pelosi actually agreed. I think it's the one joint statement that they've made in the past several months, that if they didn't have everybody in the Capitol tested, the workers, the service folks, the law enforcement folks, Capitol Police, etc., then it was sort of a moot point just to test members. So what they do is they actually have a pretty robust contact tracing and testing for a member who tests positive, and then immediately all the people they've been in contact with are traced, tested, etc. So that is, we've done okay with that, but you're always waiting for that, call from the House attending physician. that you don't want to get. So that's sort of how it's worked out. Here's another one for, this is also from Team Enough. This is for me. This is from Serena. If reelected, how will you strive to bridge the partisan divide in Congress, especially if Republicans retain the Senate and Democrats retain the House? Well, no matter what happens, Serena, I'm going to keep working with my friends and colleagues on both sides of the aisle. I'm willing to work with anybody that's willing to work with me, and I think that's evidenced by a lot of the work we've done on the Veterans Affairs Committee, where I mentioned a number of our bills got across the finish line with the support of plenty of Republicans. Same is true with some of the environmental bills that we've done. One that comes to mind is the Public Lands Renewable Energy Development Act that I introduced a while ago with Paul Gosar, Republican of Arizona. There's a number of his Republican colleagues on that bill. I think it's important that we continue to try to be civil, to turn down the temperature however we can. And unfortunately, a lot of it starts from the top. A lot of it starts, the unfortunate partisanship that we've seen starts from the top. But I think member to member level relationships are really important, and I try to maintain as many good ones as I can, and I'm proud of that work, and I'll continue to do that as long as I serve. Here's one for you, Doctor. This is from John in Vista. Are any companies working on producing at-home coronavirus testing kits? If so, when do you think they might become available? Thank you for taking my question.
Good question. Hold on, let me get to the right page of my notes here. So it turns out, John, that you ask a question about a very active area of enterprise related to coronavirus, and the FDA has authorized at-home coronavirus tests sold by 9 companies. They're not approved by the FDA except for emergency use authorization. So none of them have gone through the rigorous process of FDA approval. But this kind of authorization allows unapproved products to be used during a public health crisis. So there are 9 kits out there. They are PCR tests. So even though it says at home, what that really means is you can buy the kit. You can buy it online. It'll be mailed to your home. There's video support to collect the specimen. It might be a nasal swab, or it might be spitting in a tube. You mail it back to a CLIA-approved laboratory, and it gets tested in the laboratory. So at home's a bit of a misnomer. There are no testing machines that you can bring into your house and just test yourself in the morning, as part of your normal option, and then decide not to leave if you find that you're infected. Costco has a test now. These tests are kind of expensive. I think you only get one test, and it costs somewhere between $100 and $160. So I still think the best option is to go through your healthcare provider for testing, or go to a free testing site in your county. But there are, this is what they mean by at-home tests. They want to develop home tests that are like the rapid testing platform that people can use themselves, but there's controversy about that, because let's say that we all have these in our homes, and there's a lot of ways to game the system. You could have someone else take your test if you wanted to get on a plane or go somewhere and present this test from another person. If you find that you're infected and don't report it, there'll be no contact tracing. So from the public health perspective, those kinds of tests sound attractive. I actually hope we do have that sort of thing someday. But we don't have completely done at home tests yet. So I hope that answers your question pretty clearly.
Thank you for that. This is from Maya in San Juan Capistrano, who asks, voter suppression is a major problem in certain states, yet state governments are mostly in control of running elections. What can the federal government do to step in and ensure that our elections are being run honestly? Well, first and foremost, we can pass the John R. Lewis Voting Rights Act, which we passed in the House a number of months ago. It's sitting on McConnell's desk. Not to pick too much on him, but that's where it sits. That's where so much of what we've tried to do in the House sits and collects dust, even those things that are bipartisan. Last I heard, there were 340 bipartisan bills sitting on McConnell's desk right now. He must have a pretty big desk. But one of those is the John Lewis Voting Rights Act. And what it would do is restore the original intent of the 1965 Voting Rights Act, which has been whittled away by the 2013 Shelby County versus Holder Supreme Court decision, little by little. And we're now seeing that play out in various efforts for voter suppression and disenfranchisement in a number of states. And it's outrageous. It's outrageous that we're taking a step back in that regard. And we're going to pass this legislation, and it's going to, if Joe Biden and Kamala Harris are in office, it will go to their desk, they will sign, Joe Biden will sign, and we will move forward. Here's one for you. This is from Carla in Del Mar, Doctor. What do you think the daily case numbers of infections, or why do you think the daily case numbers of infections has jumped so quickly?
You know, that is an excellent question. And I can only, okay, so let's talk about why they would jump so quickly and why Vice President Biden said in his debate the other night that we're entering a very dangerous part of the year. So what's happening could be explained by a number of factors. One is universities and schools are back in session, and we don't have full comprehension of how much that's contributing to the spike in cases. Places like New York City have opened up and are starting to see, the Northeast is starting to see another spike more generally. And this may be due to the cooling weather and the fact that the humidity goes down. When the humidity goes down, you have the mucous membranes in your respiratory tract are not as resilient to viruses. It's easier to get a cold and every other kind of coronavirus. So it could have to do with the colder weather and the decreasing humidity. It also could be that as the weather gets colder, we spend more time inside. And as you've heard Dr. Fauci say over and over again, outside is better. It decreases virus transmission. Inside is worse and easier for transmission to occur. So that's kind of the scary thing going into the winter. With over 80,000 cases a day, we very well may have to do something pretty dramatic to get this under further control in the United States than we have. Right now, we have more cases per day than at any other time in the pandemic, and it's not even fully winter yet. So get a flu shot and try to stay away from other people, and let's do what we can to keep this under control. I think the next November, December, January, February are absolutely going to be critical for the United States of America.
Well, and it'd be great if we had a president who wasn't leading the resistance to his own public health experts' recommendations by holding super spreader rallies all across the Midwest and Southeast and everywhere else. Anyway.
Yeah,
only 10 more days.
Our worst enemy is misinformation. I should have said that when I opened today. There's a lot of misinformation out there and continues. The public health officer in Montana, where they have just a huge outbreak happening right now, calls the coronavirus a hoax. The public health officer. So that's why we have these town halls. That's why we research the answers that we're giving you. We want you to have the best information and act upon it. So I think our whole country has been struggling with misinformation, and we're so fatigued by it. And we so want this to be over. It's a hard time, that and the election. But we can talk more about misinformation later. It's just talk about an epidemic. It's an epidemic of misinformation.
I think that's well said. One of the biggest reasons we do these, and we've done 46 of them, and we'll continue to for as long as we are enduring this challenge, is to try to counter with whatever audience we've got. Try to counter misinformation with facts, with science, and with experts such as yourself and Dr. Garfield and others that have joined us so often. And I'm just going to keep at it with our little. We can make a little dent in our own community, trying to get the facts out there so that people can make responsible decisions based on evidence and based on science, based on common sense. Here is one for I think this is for me, from Serena with Team Enough. How do you think we can best address the importance of safe gun ownership, especially due to the uptick in gun purchases during the COVID-19 pandemic? That's an excellent question, Serena. I'm concerned when I see those numbers spike. And I think that one small but important thing that we should do is encourage everyone who does have a firearm in their home to store it and lock it safely. This is something that my wife and I, before the pandemic, we have young children. Whenever they would go to anyone's home, we would always ask the parents if they have firearms in the home, are they locked? Are they stored? We know, again, the statistics are overwhelming on this, that if the firearms are locked and stored, the accident rate, the suicide rate goes down dramatically. And that's the idea behind the Prevent Family Fire Act, which again would provide that tax credit for the sale of those devices. And I hope that we're going to be able to get that bipartisan bill across the finish line with the help of the Brady campaign and all of our other friends and allies in the gun violence prevention movement. So we thank you. Thank you for the question. Here's one for you. This is also from Team Enough. This is from Aaron. Has there been a coronavirus vaccine developed before? What's known about it? And can it be helpful today in working toward a COVID-19 vaccine, particularly in the midst of an economic recession and viral pandemic? And I don't think Aaron is referring to the Eric Trump comment the other day that Eric Trump said his dad had already taken the vaccine and had to be corrected. So I don't think we're talking about that.
Oh my goodness. Thank you, Aaron. That's such an intelligent question to ask, a really thoughtful one. There has never been a coronavirus vaccine developed before. I will tell you that we have known about coronaviruses back to the 1960s. One of them, there's 4 strains. One of them is responsible for the common cold. And we know of 2 others that were responsible for the earlier SARS and MERS epidemics. But because the common cold isn't typically lethal, it just goes, it makes you feel terrible for a few days and then it goes away. And because SARS and MERS did not turn out to be widespread epidemics and they did not turn into pandemics, none of the drug companies that were working on vaccines decided to bring them to market because they wouldn't have been big money makers. But the work that was done is being leveraged in the tremendous effort being placed now on vaccine development for COVID-19. So our team, Dr. Garfien and I, and a shout out to Robert, who helps us research these questions, went out to look at that question and specifically, are we leveraging the information from earlier vaccine development? And we did find a systematic review on the vaccine development efforts that have gone on prior between over the last 20 years. And this review summarizes all of the work to provide an overview of what they discovered previously might be helpful, recent advances, vaccine designing strategies, and they are applying this knowledge to the current scenario. So everything's being leveraged to develop new vaccines. I read an article today that Dr. Fauci said there will be no vaccine by Election Day, which is no big surprise. He's reasonably optimistic that we will know whether one works by the end of November, and that they've already made many doses so that it'll be a challenge to distribute the vaccine, and already 50% of Americans say they don't want to take it, so that's a challenge. But we could be seeing people vaccinated as early as January, February, and we'll see how that unrolls. I've been vocal on this show before about not taking a vaccine unless it goes through all of the safety checks, and we know that it works. So stay tuned for more information as the vaccine picture emerges over the next few months.
Well, thank you for that. And I give great credit to the career scientists at our agencies. The administration for a time was trying to push to prematurely release a vaccine prior to the election, which would have cut off the requisite 2-month period between the end of a phase 3 trial and then the testing for safety and efficacy, or the taking the time to understand the safety and efficacy of a vaccine. They wanted to release it prior to the election. Continued politicization of this whole thing, and the FDA and the career officials there said not so fast. And to their credit, so did the drug companies developing the vaccine. So we've said all along that the vaccine needs to be released as soon as it's ready, as soon as it's safe, as soon as it's effective. Not one day later, but not one day sooner. It needs to be driven by the science, and so I hope that that will be the case. I think it will, based on everything that we're seeing. And by the way, our initial legislation on this, which if you've been watching these town halls, was $8 billion. The administration only wanted 1.25 billion, and we upped it to 8. And that turned out to be a pretty big deal, because what's that enabled over the last 6 months is Operation Warp Speed, and much of the rapid scale up will be due to that early investment. We also, in our new bill, in the HEROES Act 2.0, the $2.2 trillion bill, we have another $28 billion in there for the vaccine. So we are committed to getting it out there as soon as we can. Here's one from Lisa in La Costa. With the decision to confirm a replacement for the Honorable Justice Ginsburg scheduled for hearings this week and a confirmation vote on the 22nd, actually I think it's Monday now that they're talking about, can you please share with us your top concerns for Americans posed by elimination of the Voting Rights Act, the Affordable Care Act, and Roe versus Wade protection of safe and legal abortion? Well, Lisa, I don't even know where to start on this question. I am upset that they are jamming through this nominee. Amy Coney Barrett, I have no issue. Seems like an upstanding person. However, her political positions are anathema to my own. She's been clear that she would be against, and this is before the confirmation process, just in all the different things she's said and done over the years. She'd be against the Affordable Care Act. She'd be against LGBTQ equality. She'd be against women's reproductive rights. She'd be against allowing for aggressive measures to reduce greenhouse gas emissions. And the list goes on. Voting rights. So it will do tremendous harm to many of the things that I value. I'm deeply concerned about it. Justice Ginsburg was an icon. She was a hero to so many, including myself. And I don't even know where to start, but it is going to move forward. We saw Lisa Murkowski say that she was going to vote to confirm Barrett. But again, what troubles me is that a minority of, let me take a step back. The 12 members of the Judiciary Committee, the 12 Republicans on the Senate Judiciary Committee that voted voted to move the nomination to the floor for confirmation, represent a minority of the country. So you have a president who lost a popular vote, and then you have the Senate Republican leader and the members of the Judiciary Committee with Lindsey Graham. Senate Republicans represent a minority in terms of the number of people in the country they represent. So something's fundamentally wrong with that. And what will be done about it in the coming months and coming years, I think a lot of that will hinge on the outcome of the election in 10 days. Here's one from Caroline. With Team Enough San Diego, how do we, and more specifically you, meaning me, safeguard scientific integrity and hold federal agencies that protect our health and the environment accountable to science? Well, first, we need a president of the United States and a vice president of the United States that lead by example and listen to the science, whether it's on COVID or whether it's on climate or anything else. One of the first things that this administration did is they wiped any reference of climate change from any website across the federal government. Incomprehensible, but that's what they did to protect the interests of a narrow set of fossil fuel industry CEOs and executives. They then put some of those very same executives in positions Rex Tillerson, of course, became the Secretary of State. Many others became agency heads that were fossil fuel lobbyists, David Bernhardt and Andrew Wheeler, and many others as well. And so it's no wonder then that many of the policies have been directly in line with the interests of the fossil fuel industry. What we also know is that when President Trump thinks of climate change, he thinks it's a hoax. And when Joe Biden thinks of climate change, the word that he thinks of is jobs. We also have overwhelming evidence. It is completely accepted science that humans are contributing to global climate change and that we've got to reverse the greenhouse gas emissions footprint in a big way. We've got to do it soon. There was a wonderful 60 Minutes piece on the California wildfires about 4 or 5 weeks ago, where they asked one of the most well-respected climate scientists in the country, how accepted is climate science? And his answer was, it's about as accepted as gravity. So just like gravity is accepted in the scientific community, so is anthropogenic climate change. And so now the real question is, looking forward, do we want a president that continues to, put us back, set us back in terms of our ability to lead on this issue, or do we want someone who's going to think about the future, think about our air, our water, our children, and our planet? And I think it's pretty obvious where I stand on that. Just the same on COVID. Again, the misinformation that Dr. LaCroix was talking about, we know that the number one source of that misinformation lives at 1600 Pennsylvania Avenue. And that's unfortunate. And it's incomprehensible, but that's what we're seeing. And I don't know, Doctor, if you had anything you want to add about the attack that we're seeing on science.
I think you said it all.
All right. Fair enough. Particularly in a district like ours, by the way, where you've got some of the best scientists in the United States, whether it be on life sciences, biotechnology, epidemiology, clean energy, oceanography, climatology. When you think of who we have, the intellectual capital that we have, it's personally offensive when you represent so many great scientists, so many wonderful institutions, to have the president, the head of the federal government, consistently try to undermine and discourage the belief, the adherence to accepted science. I just find it entirely disgraceful. So I hope I wasn't unclear for our viewers on that. Here's another one. This is from Lewis and Encinitas. I saw in the news that remdesivir has now been approved in this country as a treatment for COVID, but I thought international studies had determined that remdesivir has little to no benefit. Thanks to Trump, I don't know what to believe anymore. Can you explain the discrepancy?
Good question. I think we were so excited that remdesivir early in the pandemic seemed to benefit hospitalized patients, and that, it was just that there were some things that we could use. The U.S. Food and Drug Administration approved this medicine for use in adult and pediatric patients over the age of 12. And they did this for hospitalized patients only in a healthcare setting capable of providing acute care. And so this is the first treatment for COVID-19 to receive FDA approval. So what they're saying about it is that it is absolutely not a blockbuster drug or a miracle drug. It does seem to shorten the course of the hospital stay. It doesn't seem to reduce mortality, which is frustrating. The doctors wish they had more ammunition against COVID, but remdesivir was approved because it does have some effect, and there's nothing else. We have that steroid that people have been benefiting from, dexamethasone, which is a low-cost steroid that's now widely used. And, we're still searching for other drugs that might be helpful. You saw that President Trump got sort of everything under the sun thrown at him when he came down with COVID. Proven drugs, compassionate use drugs, everything under the sun. And that seemed to benefit him with the most state-of-the-art care available to anyone in the United States. We don't know exactly what benefited him or how he would have fared without it, but I can just tell you that most people that get hospitalized with COVID don't get that kind of care, don't have access to those same drugs. For them, having remdesivir in the hospital might make a difference in their course, even if, it might make it a little less severe, might make the stay in the hospital a little shorter. And if we keep going down this road of 80,000+ cases a day and fill up the hospitals again, that could be a very valuable benefit.
Well, I appreciate all of that. And, the president had access to the best medical care, had access to Regeneron with a compassionate use, had access to remdesivir and everything else. And when he came out from 3 days at Walter Reed, and he said, hey, no worries, everybody's going to be just fine. They, just like me, they'll just get Regeneron and it'll all be just fine. But my understanding is you can't get Regeneron and it's incredibly expensive. And that will be the case for some time. That assumes that it works. And, again, that's as yet undetermined. But thank you for that answer. Serena with Team Enough asks a very interesting and very difficult question. She said, no matter which presidential candidate wins this election, how do you believe the aftermath of the election will go? If there is violence, how will you work together with local, state, and federal officials to maintain peace? Well, first of all, I think, Serena, it's important to acknowledge your concerns. It's important to acknowledge the possibility of violence. I want to believe that there won't be, but we have to acknowledge that is a possibility. And I think it's important that in my role as a federal official that I do everything possible to try to bring our local law enforcement community together, but also to operate as we have with transparency, with accountability, and make sure that we have a peaceful transfer of power. It is, and that's, in the instance that the former vice president wins the election. It is so sad to me that we had to have a resolution on the floor of Congress reaffirming our belief in a peaceful transfer of power. I never would have predicted that that would have happened, but that's how it went down. And perhaps even more disturbing to me was the fact that 5 of my colleagues in the House, Republicans, voted against that resolution, would not affirm the importance of a peaceful transfer of power. So, of course, the president has fomented much of this discussion with some of his comments. And, generally my belief is that when the president says something, he ought to be taken seriously, whether it's the peaceful transfer of power comments, whether it's the comments around disinfectant. He said during the debate that he was joking, but I don't think the tape shows he was joking when he said that back several months ago. I think it shows that he was genuinely asking Dr. Birx about that. But when the president says something, I think we owe it to ourselves to take it seriously. When he makes comments about not accepting a valid result, we're trying to discredit the ballots of millions on the basis of them being mailed in. I think that is a huge problem, a huge blinking red light that we've got to take as a warning, prepare for, and do all of our best in every way that we can to try to counteract with the facts, with the truth, and by bringing people together however we can. And that's what I'm going to keep doing. Here's one for you, Doctor. This is from Frank in San Juan Capistrano. And we alluded to this earlier. During the debate, the vice president said that we are looking at a dark winter this year in terms of COVID-19. What does he mean?
Well, I think what he means is that the United States hit an all-time high in new coronavirus cases Friday, surpassing the previous mark set during the summer. The first time we've been above 80,000 cases in a day. That's continued for a second day. Hospitalizations are soaring across the country. According to data tracked by the Washington Post, the average number of hospitalization has jumped in at least 38 states over the past week, a trend that cannot be explained by more widespread widespread testing despite the misinformation you hear coming out of the president's mouth. 14 states have reported new highs in hospitalized COVID-19 patients in the past 7 days. I won't tell you which ones, but I'm happy to say California is not one of them. Health experts say the current wave is setting the stage for an even greater surge heading towards the colder months. And as I explained to you before, that's because of the drop in humidity, the move to the inside, the influenza and other coronaviruses that circulate swell in the winter and drop in the summer. So there's more virus around in general. And we don't know, there's no indication yet that COVID-19 is going to be a seasonal virus, because it's actually peaked around the country at different times of the year, peaked in the South during summer. People will be interacting more indoors in places with poor ventilation. Poor ventilation is bad. And the disease modelers are now factoring that into their calculations. Sadly, if we screw this up in every way possible, they're now predicting that just during the summer, we could lose 300,000 Americans on top of the almost 3,000 we've already lost. So this is a serious projection, and I think we need a government that will do everything in its power to make that not happen.
Thank you for that. We have 4 more questions for you, Dr. LaCroix, and I want to get through these 4 questions with the time that we've got left. First one is from Charles in Carlsbad, who writes, now that I've started going back into the office a few days per week, I've been getting tested more regularly, and I've been going to a place that uses a rapid test. How reliable are the rapid tests?
Well, Charles, the rapid tests are not as accurate as the PCR tests. The actual number, I can't give you one number. You would have to know the actual tests that the actual platform that they're using, and go to the FDA website where they publish the sensitivity and specificity and the positive predictive value of each test that's gotten emergency use authorization. But let me give you a general sense. We think that the rapid tests are less sensitive, so you have to have more virus to get a positive. We think they miss some positives that are more subtle that would be picked up by PCR, and we also think there's some false negatives. We know the PCR test gives false negatives in the early days. Like if you get tested on the first day you're infected, you have almost 100% chance of testing positive, even though you're shedding virus while you're infected. So the best time to pick up an active infection is when you're symptomatic, to about 8 days after that, maybe even less. So in answer to your question, I would not assume that the rapid test, if you have a positive, they'll test you with a PCR to confirm it. If you have a negative, you can't be 100% sure that you are not infected. And the White House outbreak and these super spreader events are proof positive that getting tested doesn't prevent the spread unless you contact trace and take precautions, masking and social distancing. Just being tested reduces the spread of the virus through removing people who are infected before they can infect many more people, and then doing contact tracing. It is not by itself, doesn't keep you from getting infected. So that's something to keep in mind. But I'm glad you're getting tested at the office. I'm glad they have a platform, and if you turn up positive, get another PCR test. I will say workplaces have been one of the consistent places where outbreaks have occurred in San Diego County. We still have a large number of outbreaks. Our goal is below 7. Some days we have 30 or more outbreaks defined as 3 or more people infected from the same place. So stay safe in your workplace. And I know people are going into the university and working in their offices and doing so safely. It definitely can be done.
Here's another one. This is from Susan via Facebook. The subtleties of this virus are quite astounding. Is this true of all viruses?
Yeah, it's a good question. scientists actually know a lot about how viruses behave in general. They have to make their way from an infected person to a new host. They have to find the appropriate cell in our body to infect, attach to the cell, enter the cell, take over the cellular machinery, and begin reproducing themselves. And then they disrupt or destroy the cell to release the virus, and then they find new cells to do that again and again until your immune system kicks in, or you take medicine that breaks that chain inside yourself. In terms of the coronavirus, as we said before, it was first identified. Coronaviruses were identified in the mid-1960s. A relevant question to the one you raised is, so if we've been studying and collecting data on the family of coronaviruses for so long, why is the COVID-19 strain causing a global pandemic now? And why? Why couldn't we have gotten on top of that? So there are 4 strains that we know about. As I said, the common cold is one of them. The 2003 SARS outbreak is another one. The MERS outbreak in 2012 is a third one, and now COVID-19, SARS-CoV-2. The reason we call it novel is that it's never been seen in humans before. And the reason you're describing it as nuanced is that it affects, the fact that it affects people so differently, that people can be asymptomatic or they can die, and everything in between makes that a very nuanced influence on different bodies. And we're still learning a lot about what puts us at risk of a more severe presentation. And like you said, Congressman Levin, what's going on with asymptomatic infection? How come some people can get it and not even know? But in general, the take-home message about this question is that we scientists do know a lot about how viruses work already. Every virus is somewhat unique, so it takes some time to observe how new viruses behave. This one just happens to be very infectious, and some people really are so seriously affected that they end up dying, and that's why it's such a bad pandemic.
Thank you for that, and we are running out of time. So one last question to me, which is, what is your message to young people and first-time voters? And it's pretty simple, is that you can make a difference and you should try. This is your democracy. This is your country. I'm inspired by you. I am proud to stand with you. And I think of the last 2 years and the different marches around issues like gun violence prevention and climate change, and the leadership of March for Our Lives and so many others like Team Enough who are on with us today. I have been inspired, I have been motivated and encouraged to keep fighting. And I have 2 young kids, my wife and I often think about the type of world, the type of values they're inheriting. And I just know that America is at its core better than what we are seeing today. Better than this polarization, better than this misinformation, better than the national narrative, the social media narrative. We are just better, I believe, fundamentally than this. And I think your advocacy has demonstrated that over the last couple of years. We'll continue to demonstrate that in the years ahead as you go into public service, as you lead nonprofits, as you lead in business. And I can't wait to see all that wonderful work. But for right now, you've got to participate, you've got to vote. It's not a perfect process by any stretch, but it's our process, and we've all got a voice, and you've got to exercise that most important right that we've got, and that people have fought for many, many years. Can't take it for granted that we still live in this extraordinary democracy. We've seen it pushed to the brink, perhaps. And we may see that in the weeks to come. But I know that based on everything that I have seen from this next generation, that you're up to the challenge of making things a little bit better. Continue that arc of the moral universe, which we heard a lot about under President Obama. I still think that arc of the moral universe over the long run is going to point back in a positive direction. So thank you for the question. Thank you for what you do, and make sure that you get out there over the next 10 days. With that, I know Dr. LaCroix has a closing statement as well, and I want to turn it over to you and just thank you again for all that you do.
Well, thank you for allowing me to participate. And I just want to say thank you to all the campaign workers. Thank you for everyone who's participated in the democratic process, whatever your leanings. Thank you for the people who are holding signs on the street to keep the post office open. Thank you for the postcard writers. Thank you for the two women who harassed me when I turned in my ballot to make sure that I had signed it at the Encinitas Library. I want to thank everyone, and then just end with an excerpt from the essay that John Lewis left us with when he died, as we go into this next period of intense voting and the end of what's been a very heart-wrenching voting season in the middle of a pandemic. It's a beautiful essay, but let me just read one paragraph of it. Ordinary people with ordinary vision can redeem the soul of America by getting in what I call good trouble, necessary trouble. Voting and participating in the democratic process are key. The vote is the most powerful nonviolent change agent you have in a democratic society. You must use it because it is not guaranteed. You can use it. You can lose it. Though I may not be here with you, I urge you to answer the highest calling of your heart and stand up for what you truly believe. In my life, I have done all I can to demonstrate that the way of peace, the way of love and nonviolence is the more excellent way. Now it is your turn. Now it is our turn to let freedom ring. So that is my closing statement.
Well, thank you so much, Dr. LaCroix. And I miss John. I wish he were here. Got to learn from him, got to know him, and wouldn't even try to follow those words with any of my own other than to say thank you. I want to thank my amazing team again, our great campaign team, also our team in Washington, D.C., and our team in the district offices. Thank you all for all that you do. I want to thank my amazing family, my wife, Chrissy, our two wonderful kids, Jonathan and Elizabeth, our extended family, my parents, my in-laws who are watching in Tucson, my brother-in-law whose birthday is today. I almost messed that up. I have to wish my brother-in-law a very happy birthday. My father-in-law's birthday is coming up very soon as well. So in advance, I'll wish him a happy birthday. And to everybody out there, again, please practice social distancing, wear the masks, do what we know will limit community spread. This is not a political statement. Let's just exercise our best public health practices and keep each other safe and keep each other healthy, particularly if you're going to vote on election day. Wear a mask, socially distance, keep everyone safe. The people that Dr. LaCroix just mentioned who are working at the polls. And we thank everyone for tuning in over these last 46 town halls for all that you do. So thank you, and we'll see you soon. And don't forget to vote. Take care, everybody.